Well, I'm being told that state health leaders are concerned about the rise in the community spread of COVID. So much so that the mandate for testing nursing home staff has gone from once every 2 weeks to once a week. For the reporting period of October 14th through the 20th, 71 residents and 86 staff have caught COVID at Connecticut's 213 nursing homes. 15 more nursing home residents have died.
There have been 3 or 4 outbreaks that are a concern, and I think they are evidence of community spread on the rise.
Recent outbreaks include the Avon Health Center, touch points at Chestnut and East Windsor, Fairview and Groton, and Autumn Lake in New Britain. In a memo to all nursing homes, State Health Commissioner Deidre Gifford is now mandating weekly testing of all healthcare facility staff, and when a case is identified, weekly testing of all residents too, until 14 days of no cases.
You can't just talk vigilance, you need to act vigilance, and the commissioner's direction here is an act of vigilance, which we support.
And while the testing of staff and residents is mandatory, the state can't mandate the testing of visitors. The federal government won't allow it.
We've seen an increase in numbers in our state. We've seen an increase in nursing homes with positive tests and the impact to indoor visits.
Nursing homes have been trying to get around the lack of a federal visitor testing mandate by putting in place their own visitor testing policies. But they legally can't refuse a visitor entry solely because they decline to be tested.
Now, there are some reasons why a nursing home could deny a visit.
If they're showing symptoms, for example, or refuse to wear a mask. But Painter says despite its wide availability, testing can also be a barrier. Things like transportation and delayed results.
Some homes have requested that a person be tested up to 72 hours before. That might be a challenge.
But with the weather getting colder, many of these families are telling me indoor visitation is a necessity. These residents have been largely cut off from any interaction with their family for the last 7 months, leading to mental health issues like depression. Outside the Department of Public Health in Hartford, Matt Caron, Fox 61 News.